Begin with the news about former talk show host Wendy Williams, 59 years old, television star by any definition. She revealed yesterday that she's been diagnosed with a form of dementia and aphasia. Frontotemporal dementia is what it's called, also known as FTD. It's caused by a loss of nerve cells in the brain, and it can lead to behavior changes and reduced motor function. Williams also has the associated disease aphasia, which affects her ability to communicate. Actor Bruce Willis, you may recall, suffers from the very same neurological diseases. The news comes just before tomorrow night's premiere of a Lifetime documentary on Williams' life after hosting talk shows. Here's a peek of that.
Even if they don't know the Wendy Williams show, everybody instantly falls in love with me.
That's boss.
That's boss.
Boss Wendy.
Is boss lady.
Yes.
I don't know what wealthy is. I don't want to be wealthy. All I wanted to do was be famous.
Dr. Gayatri Devi is a clinical professor of neurology at Northwell Health who specializes in dementia, and she joins us now. Doctor, thank you very much for being here. So this diagnosis, what is it and how does it affect patients?
Frontotemporal dementia is when you have loss of nerve cells in the brain that causes cognitive issues, much like other types of dementias, including Alzheimer's, Lewy body, but frontotemporal is a type of dementia. The biggest problem with frontotemporal dementia is it can be hard to diagnose. Oftentimes, patients can just present with behavioral problems, their personality can change, but as opposed to something like Alzheimer's, there's no clear test to definitively make the diagnosis.
Well, that's scary. You know, I had never heard of it until we heard it about Bruce Willis. So how common is it, and is there an age range? Because Wendy's still very young, 59?
Yes, yeah.
How common is this?
It's uncommon amongst the dementias. Alzheimer's is the most common. Vascular dementia is the second most common. Frontotemporal is a small portion of patients with dementia, and it usually affects younger individuals, people in their 50s and 60s, as opposed to Alzheimer's, which affects older individuals.
Does it physically affect you? We see Wendy's eyes are bulged, but I think that's from something else, right? It doesn't cause...
It shouldn't. I mean, frontotemporal dementia usually doesn't cause physical symptoms early on. Eye bulging and things like that shouldn't be a part of it.
It's been reported that she suffers from Graves' disease.
Oh, that could very well be it.
This is an important conversation
Yes,
because
it is.
whether you're dealing with it personally or through 6 degrees of separation, we all know someone. And that leads me to this question. When you hear about it happening in your family, should you be concerned? You know, are these diseases, is dementia something that runs in families or passed down through hereditary genes?
So there is some genetics to all dementias, but genetics is not your destiny. Even in a condition like Alzheimer's, you can have a pair of identical twins, and one twin gets it, and the other may not get it for up to 17 years. So just to let you know that it scares everyone, but genetics is one part of it, but there's a whole another bunch of things you can do to prevent dementia.
Really?
It's treated how?
Frontotemporal dementia doesn't have any specific treatment, but you treat the behavioral problems that often go along with it.
Oof. Wow.
Yeah.
Okay.
I want to ask you in the commercial break what we can do to prevent this, because I think young people are all concerned about it.
I definitely am.
And we are pulling for Wendy
we
because
are.
the video is very disturbing. Just wondering.
And I guess tune in. It's hard to know whether she can make this decision to tune in, but her family is going forward with the documentary.
Yeah. That's a whole nother conversation. Just want her to be all right. Thank you, Dr. Debbie.
Thank you.
Glad you came to...
Thank you.